Hello, everyone, and welcome to today's press briefing. I'm Donna Bush. As always, I'm so happy you could join us here on our various channels as well as on Radio Cayman. We go now to prayer from Reverend Godfrey Magoo.
Let us pray. Our God and Father in heaven, whom we honor and praise today for the beauty, truth, and goodness which you created, and for your love for us, you promised that if we would believe, we would not perish but have eternal life. Grant that the authorities of church and state, and especially the government of the Cayman Islands, may be given wisdom in making life and death decisions. That all who work and travel under the stress of the coronavirus and other illnesses may experience your protection and healing. We pray for all medical and other research personnel, and for all teachers and students in these pandemic times. We believe in the promise of Holy Scripture that if your people who are called by your name would humble themselves and pray and seek your face and turn from our evil ways and call upon the name of the Lord, then you, our God, will hear from heaven and will heal our land. In this spirit, we pledge our devotion to thee in Christ. Amen.
And thank you very much, Reverend Magoo, for that prayer. We now welcome our panelists, His Excellency Governor Martin Roper, Premier the Honorable Wayne Panton, Minister for Health, the Honorable Sabrina Turner, and Minister for Education, the Honorable Juliana O'Connor-Connolly, who joins us in studio. Also in studio with us are the Chief Medical Officer, Dr. John Lee, senior civil servants, members of the media, as well as our sign language interpreter. We go first to Dr. Lee.
Good afternoon, everyone. We have had a total of 774 people positive for SARS-CoV-2 in the Cayman Islands, Cayman Brac being 12, Little Cayman being one of that number. There are currently 25 symptomatic people, 27 asymptomatic, and 720 recovered. I am very pleased to report today that the person who is admitted is improving, the person no longer has a temperature, and as has been throughout the person's admission, is not requiring any respiratory support whatsoever. There are 709 persons in isolation at home, and the number of flu calls to the hotline has understandably shot up for a combination of reasons. Firstly, obviously, because of concern around this particular incident, but also because there are a number of respiratory type sicknesses traveling around in the community, respiratory type, which makes it very worrying for people at this time. That we also know that there has been some COVID in the community. But there have been 134 calls to the flu hotline, of which 67 were related to respiratory symptoms. For the community case reported last, which we first learned about last Wednesday, and I've previously reported on, 3 people remain symptomatic, and 3 of the 4 remain at home. For the Georgetown primary school outbreak, which we first reported, which we knew about on Monday, the 13th of September, there are now 17 children in all who have tested positive for SARS-CoV-2, and these come from years 2, 3, 4, 5, and 6, and this affects 9 of the 14 classes at Georgetown Primary School. There are also 3 adults related, so that brings a total of 20 people related to the Georgetown Primary School event. 2 of those adults are symptomatic, and 5 of the children are symptomatic, but they're all managing well at home. The total number of tests that we've done since last Wednesday is over 7,029 PCR tests, and you can understand that's roughly 10% of our population. So a huge number of people had had PCR tests. I think these are a combination of concern, but also routine screening. I know that several thousand people have been screened out of concern, and these people come from multiple groups, from the routine screening that we've done at Cayman Islands Airports Authority, CBC and so on, but also a lot of people who work in supermarkets, concerned families, and for a number of different institutions across the island. And all of these have been negative, apart from the people that I've reported that are directly related. So that is exceedingly reassuring news for us. It's also very reassuring that we only have one person in hospital, despite the fact that we've got 24 people with SARS-CoV-2 who are in isolation with the virus. So the vaccine is working, and I am personally very reassured by the results that we've seen. Obviously, I was worried around 10 days ago, but I am feeling increasingly reassured. I just wanted to let you know that the COVID-19 test clinic at the Health Services Authority is open for people to come forward to be tested should they wish between 7:30 a.m. and midday, Mondays to Fridays. Please book your appointment online. You are able to walk up, but it is much preferable if you can book online and make a plan for turning up. Please also bring a government-issued ID and wear your own mask when you come. As far as the outbreak is concerned, because we've mentioned that so many classes have been affected, we really feel, and this is a decision which was taken in conjunction with the Ministry of Education, I thank them very much for their support in this. We felt that it's really, the simplest thing is to leave the school closed until 14 days after the event outbreak. So please, could everybody related to that outbreak remain at home, the students and the families of the students, until they are released, which we will do in due course, but that will be around 2 weeks after we first discovered the positive cases. Thank you, Donna.
Thank you very much, Dr. Lee. We now go to the Honourable Premier, Mr. Wayne Panton.
Good afternoon, Donna, and thank you. Good afternoon to everyone who is watching and listening. And I want to thank my colleagues and His Excellency for joining us this afternoon. As we said on Tuesday, and you know, government has put a pause on phase 3 of our safely reopening the Cayman Islands plan. Doing so gives us an opportunity to assess the developments over the past 2 weeks, including the emergence of COVID-19 in our community. We are purposefully taking this pause to ensure that our children are protected and to limit the spread of the virus and address your fears and concerns as we examine the way forward from here. And I want to obviously emphasize that this pause affects all 3 islands. I am certainly aware of the concerns around Cayman Brac, that we had 3 people from Grand Cayman who had traveled to the Brac, including a child from Georgetown Primary School, where the outbreak of COVID-19 was revealed on Monday. All family members, including the student, tested negative for the virus at Faith Hospital, and they're now at home in the Brac in isolation for 14 days. As I said, our protective measures are for all 3 islands. As such, Cabinet met this afternoon and agreed to amend travel and boarding regulations to allow for people who have tested negative or who are verifiably vaccinated to travel from Grand Cayman to Cayman Brac or Little Cayman. So we are obviously trying to ensure that we maintain the safety of our sister islands, particularly because they have more limited health capacity and resources there. So anyone who at least 14 days prior to the date of travel has not completed, who has not completed an approved vaccine course and wishes to travel to the sister islands from Grand Cayman must provide a PCR test no more than 48 hours prior to departure and provide to Customs or Border Control Officer on arrival a medical certificate that shows the negative test and that specifies the name and address of the approved laboratory where the test was performed. Anyone who arrives in the Sister Islands from Grand Cayman who shows respiratory symptoms or symptoms of the virus will be quarantined until the person is no longer regarded as a risk to the public. We've also dealt with provisions relating to boating, and we've reduced numbers in relation to those operating within Cayman waters, Cayman's territorial waters, from 500 down to 100 persons, or 50% of the legal capacity of the vessel, whichever is lesser. So those are included in those regulations as well. Now, hopefully these new regulations, which are going to be published this evening, and which come into effect on the 21st of this month, will provide some comfort to our friends and families on the Sister Islands. The other regulations, which we have been working on, are currently being finalized in the drafting process, and these will be dealt with and published next week. So here on Grand Cayman, I understand that there is a feeling of uncertainty over what the way forward looks like and what the risk is to you and your loved ones as we experience community spread and further impacts on your livelihood. We have been in the enviable position of living a normal life with no COVID in our communities, as we have watched and observed what has been going on around us in the rest of the world. We're certainly very grateful for the many examples, some more successful than others, that we have observed from around the globe about how respective countries have managed to live safely with COVID whilst avoiding it overwhelming their healthcare systems and claiming lives. But no tutorial, ladies and gentlemen, is more relevant and more applicable than our own lessons. So before we relax our controls, we are assessing that our actual resilience is as robust in tackling the virus and the controlling the outbreaks as we believe them to be. Our vaccines, our public health experiences, our strategic planning, our workforce continuity of operations, our school bubbles, and our community responsibility are all being put to the test and hopefully validated at this time. This pause that we have implemented also gives us an opportunity to strengthen some of these controls, to learn lessons and identify where we may have gaps, so that we reduce the likelihood of a surge of COVID-19 cases that puts lives and ultimately puts commerce at risk. We certainly want to thank the UK again, not only for the vaccines that we have been provided with to date, but as you will recall, His Excellency noted in the last press conference that we had approval in respect of the booster shots, and he will have more to say in respect of those. They'll be arriving soon. Once we go through this process, government will have a better sense of the way forward and how we can do it more safely. And our citizens, really importantly, our citizens will, I think, have increased confidence in our ability, and our meaning the country, our society, our systems, to handle this, and allow us, in terms of our local ability, to basically rejoin the wider world. We have always known that COVID-19 would reach us, would reach our shores. We have spoken about it often, and it is now a fact. It is in our community. We still don't know exactly what the source was, but suffice it to say, it is here and it is a reality, and we must deal with it. We all knew, both those who believe we need to open the border and learn to live with COVID-19, and those who believe otherwise. The important thing today is, with that knowledge, we need to give the country hope. We need to instill confidence in the people. And I think the experiences we've had so far, the information that Dr. Lee has provided, has demonstrated that we do not have people who are significantly sick at all. So that is a process that we can go through, and hopefully, you know, we don't have any significant sickness at all, and that, once we've gone through that process, that gives us a sense of confidence as well. But we can also take a lot of confidence from the fact that the significant level of surveillance testing that we've done shows that we don't have, you know, we're not likely to have an uncontrolled surge. And I think also, importantly, undoubtedly, particularly in relation to the adults, obviously, the fact that we have so many people vaccinated, and so many of those who have been positive have been fully vaccinated, and are not having significant symptoms. That is a very positive thing. That is another thing that should give us considerable confidence. I believe we can get through this. I can believe we can do this without having to do any kind of lockdown or any kind of specific difficult interventions that may have been considered in the past. I think we all understand what the health protocols are that we need to stick with and practice. We know what we're supposed to do. We're supposed to wear masks while indoors. We are supposed to keep our hands clean with hand sanitizer. Use that, do all the things that we know we've been practicing, we've been talking about, not just today, not just in the last month and several months, but going back to, you know, March last year and subsequently. Let's do this. Let's do this, Cayman, and let us make sure that we are practicing all of those and addressing our fears and concerns. Our vaccines, our public health experiences, or our strategic planning, our workforce continuity of operations, and the school bubbles will hopefully put us in a good position where we're able to test and validate all of these at this time. So the really important thing I think we need people to understand at this point is to remain calm. Everything that we have learned has taught us that we can have building and growing confidence that we can manage this. And this is what we need. This is what the country needs. This is what the people need. I know that there are people, there are components within our society who are unhappy that we have paused the reopening plan, who are concerned about businesses, who are concerned about livelihoods. Every component of our society needs to understand that we understand those concerns, and we are looking to be addressing those We will be engaging with the business community. But our focus is on making sure that our people are safe first, and that the concerns around the stress and fear of this have the opportunity to be addressed by the systems that we have and by the experiences that we are learning as we go through this. This is one more challenge along the way that we will overcome. And as my government pursues its commitment to improve the quality of life for this and future generations of Cayman, our vision for Cayman is going to become, I believe, a reality. We want Cayman to be held up as one of the most sustainable countries in the world, a trio of islands where all of its citizens can thrive and have a peaceful and prosperous existence. We want Cayman to be a place known for its resourcefulness, its diligence, its excellence, and its innovativeness. This pandemic, as I mentioned earlier, obviously requires us to balance various interests, balance the economy, balance society. And in doing so, we're going to try to strike the right balance. But we are also, as I said before, going to put people first. So my colleagues and I who form the government are in unanimous agreement about the values that will drive our decision-making. I think everyone's all familiar with the acronym, which is PACT, which is people-driven, accountable, competent, and transparent. Despite the views that others may have, there is no playbook, there's no certainty around the process forward with this. And we are going to do this together. We're going to stick together as a community. We're going to reflect the concerns and the interests of the people, and we're going to balance the concerns of everyone else. And we're going to learn as circumstances change, and we're going to adapt as circumstances change, provided we're guided by the guiding fundamental values, as I said earlier, that is supporting the people of this country. As you know, I have a theme of community creates country, and I believe that it starts from our communities, and that means it starts with our people. If our people are safe, and they feel that they understand where we are and where we're going, and they feel that there is a process through which they can assess the risk and work with that, I believe we are going to have a successful country and a successful transition through the phase of difficulties that we have. Public health, the advisors to government, we've all been preparing for this day. And clearly we have learned many lessons about our resilience, about our systems and the community's readiness. And that has factored into our decision making in relation to the pause, and that is going to help guide us with the way forward to ensure that we can successfully do this. We must now prepare ourselves to go ahead with these added safeguards that we've talked about in terms of the regulations and the regulations which are going to be implemented next week. Because our borders can't remain closed forever. And with these added safeguards in these regulations that we've talked about and the regulations to come, I believe it puts us in, as a country, in a very strong position, puts us in a much more resilient position, and it gives confidence to our people, and it protects those elements of our society and protects those areas of our country where we have concerns around safety and access to health services. So with that, I want to say thank you very much. And may God continue to bless these wonderful Cayman Islands.
Thank you very much, Premier Panton. We now go to His Excellency.
Thank you very much, Donna, and good afternoon, everybody. Like the Premier, Dr. Lee's update is very reassuring, and I think it does give hope that we are effectively containing these outbreaks. And I do just want to send my very best wishes to everyone who currently has COVID, and I hope that they all make a speedy recovery. The government's announcement that following a small number of community cases of COVID, that it was pausing the 14 October reopening date and strengthening measures to contain COVID, has created divisions within our community. Many were palpably relieved, primarily out of concern for our unvaccinated children under the age of 12. Others were distressed and some angry. Long-awaited family reunions would have to be cancelled. The logistics of children returning to Cayman for Christmas from educational institutes around the world was suddenly more complicated, and representatives of the tourism industry predicted business failures and an unrecoverable future. The reaction of parents with young children was understandable. Unlike parents in other countries, you have not had to deal with the realities of COVID in schools and nurseries. And hearing experts or even us on these panels tell you that children do not generally suffer from severe COVID was no reassurance. But hopefully, now that you have seen what an outbreak might look like, you can better understand the reality and really appreciate how vaccines work to protect the unvaccinated. All the children are doing well, as Dr. Lee said. If school staff are vaccinated, they are much less likely to spread the virus to your children, and the same is true for parents. And it is especially important for those whose work could bring them into contact with people carrying the virus. Until a vaccine is developed for children, and that is, unfortunately, some way off, this remains the best way to stop your children being infected with COVID. So I do want to thank everyone who has been and remains at the forefront of dealing with this outbreak, all of the staff working tirelessly to perform and analyse the PCR tests, those carrying out contact tracing, those activating their response plans designed to keep us safe. I want to pay particular thanks to Steve Barrett, the prison director, and his team, who took very swift action when a staff member tested positive. And I want to pay tribute to excellent collaboration between prison staff and prisoners on common sense measures to protect everyone at the prison. The low vaccination rates in the prison, both among inmates and staff, do give me cause for concern, and I would like to implore everyone who still hasn't had the jab, perhaps in the belief that COVID would never reach these islands, to now do so. It is the best way to reduce the likelihood of serious illness. And as we've heard in recent days, 7,000 tests, that's 10% of our population, which is an incredible achievement by public health and reassuring that we have relatively very few positives. And I believe it does already show to some extent that our high vaccination rate stopped the virus in its tracks, as we expected it would. And seeing for ourselves that those in our community do not get seriously ill or worse because of the high vaccine take-up will give reassurance and, I hope, allow government to reassess next steps in the weeks to come. On vaccines, as the Premier said, I'm very pleased that the next delivery of 11,000 doses will arrive from the UK on the 27th of September. This will be on the first commercial BA flight following the end of the risk-sharing agreement. And many thanks to Minister Bryan and his team for negotiating this resumption of normal service, which will ensure our students, business people and others can continue to fly to and from the UK. The arriving vaccines can be used for first and second shots, as well as for the first phase of boosters for qualifying people who came forward at the beginning of our rollout. HSA will be handling that in their usual very effective way. More booster vaccines will be delivered on flights after 27 September as we need them. All over 50s will be offered a booster, and the small number of immunocompromised people have already been advised to have 3 doses rather than 2 shots. Now, some of you will have seen today that the UK announced changes in the way they will be dealing with incoming travellers. The UK has abolished the green and amber lists and now only has a red list. Very pleased to say we are, of course, not on any red list. Decisions about what you need to do on entry to the UK from Cayman now depend on your vaccine status. The UK recognises vaccine certificates from Cayman, so those fully vaccinated here will continue to benefit from no quarantine. From the 4th of October, you will no longer need to take a pre-departure test to go to the UK. Until the end of October, you will still need to do a day 2 PCR test, but thereafter you will only need to take the cheaper lateral flow test. If you are unvaccinated or partially vaccinated, from the 4th of October, you will have to do 10 days in quarantine on arrival and take PCR tests on days 2 and 8, and you will still need to do a pre-departure PCR test. To conclude, I'm hopeful that getting even more people vaccinated, rolling out our boosters, demonstrating that we can contain local outbreaks, will help heal the divides and enable the entire community to feel reassured and ready to move forward in a spirit of unity with a safe and cautious reopening plan. And as I've said before, seeking to wait out the pandemic is a forlorn hope. We have to learn to live with it. But I am confident that Cayman will achieve that and will prosper mightily. Thank you.
Thank you very much, Your Excellency. Now go to the Minister for Health, the Honourable Sabrina Turner.
Good afternoon, everyone, and thank you, Donna. As we come to an end of another week, we have so much to be thankful for, and given the recent news of COVID in the community, we must give thanks for the fact that despite the fear, the fatigue, the uncertainty, and even anger some may have felt, be it for or against what we have announced, one thing we ought to take away is that we all still have life. Let me again take this opportunity to applaud the business community and the churches and each and every individual for being proactive. I have observed many of the business establishments and them implementing public health safety measures that consist of mask wearing, hand sanitizations, and social distancing. This proactive approach and behavior really and honestly speaks loud and clearly demonstrates of who we are when it comes to our community and personal responsibility. It also demonstrates and shows a willingness of everyone who is willing to work hand in hand with your elected government as we do our part to live and manage the control and spread of this virus. I'd like to take just a few minutes to urge everyone to make decisions that affects the greater good. As Martin Luther King Jr. famously said, life's most persistent and urgent question is, what are you doing for others? The way we answer that is by doing our part by adhering to social distancing, wearing of masks. When you're in closed areas such as supermarkets, the weekend is here, many of us are going to church, and by large crowded areas. The political posture of this elected government when it comes to the safety management of COVID is getting vaccinated and vaccinations, not by any means a lockdown, as previously stated by our Premier. In the most recent community spread, the decision for isolation was really and honestly made for the safety of our people out of an abundance of caution. At this particular time, we feel the need is there, and we are being guided by public health experts and our very own CMO to be hard and fast in our actions in controlling the spread and definitely keeping our most vulnerable, our children, and those who are most at risk safe, still respecting those who cannot be vaccinated, who don't believe in getting vaccinated, or those who are just unsure. Pandemic fatigue, I am sure at this point, and I know is real. The thought of being jobless and the overall uncertainty of the quality of life. But let's take it all one step at a time, bit by bit, day by day, as we all learn and become educated and grow to live with the reality that COVID will not go away. COVID will not be eradicated anytime soon. But in the meantime, the way we can live safely is pretty simple. Simple in it that we practice non-surgical public health measures, such as washing of your hands frequently, wearing of your mask in public places, especially when visiting the vulnerable and our elderly, social distancing from those who are not a part of our immediate household. Now, this is of utmost importance when visiting high-risk loved ones, no matter how much you want to just give them that little hug, going to grandmas and aunties, and for those of you who are just ready to throw down a 6-love on a friend or play a game of Ludi, even though you're around those tables this weekend, wear your mask. That is the right thing to do. Make sure that everyone in your household use and have access to some form of hand sanitizers. And teach your children to sneeze and cough in their elbow. This is a small action that each and every one of us can take to stop the spread of germs that makes many sick, not just from COVID, but from any other communicable disease. I know that many in our community right now are really worried and are feeling high levels of stress as this community spread is definitely amongst us. But I would like to reassure each and every one of you this afternoon that public health again remains very diligent. At the last press briefing, I spoke about the growth and plans of public health, their team, and I'm comforted to know that they're positioning themselves to react in any possible scenario. I am also fully aware that some people are also there's a growing concern over the new data that was released by CDC that shows that, vaccinated persons infected with the Delta variant especially can still carry detectable viral loads similar to those in people who are unvaccinated. Worries about the vaccine and transmission are a hot topic. So let me join into the conversation with just a few points. So far, we have seen in the most cases, if a person is vaccinated, the high levels of the Delta variant will rapidly diminish. So if you are vaccinated, the high levels of Delta in your system, if you ever contract it, is highly diminished. While it may sound discouraging, some may throw up their hands and says, well, what foolishness are they saying? Why even bother? Even though it may sound discouraging, the vaccinated people, which is what I want each and every one of you to take away with you this evening, can still catch disease or even pass it on. But one thing to keep in mind is that the vaccine still, by data proven, remains highly effective in preventing severe illness. Breakthrough infections among vaccinated persons remain fairly much uncommon. It is there, but a breakthrough infection when in someone who is fully vaccinated and becomes infected with COVID-19, the majority of those persons around the world and deaths result in those individuals who are unvaccinated. That is the key takeaway from this. I do understand that there will be some who may be unable to get vaccinated, be it for medical reasons or other reasons. In these cases, it is very important for you to then adhere to and follow the preventative measures and closely that are all issued by public health officials and business establishments that have the right to require any person who enters their place of business to wear a facial mask or some sort of facial covering. Social distancing also applies to indoors as well as outside to protect yourselves and your loved ones. Without the vaccines, these measures are a line of defense to each and every one of us. Now, protecting our community makes each of us everyday heroes. Stay safe, Cayman. Stay safe, Cayman. Stay healthy, Cayman. And have a safe and blessed week.
Thank you very much, Minister Turner. We're now going to go to the media, some of whom are joining us via Zoom. We begin with April from Radio Cayman.
Hi, Donna. Thank you very much. My first question is for the Premier. And I guess what I would like to understand is you said a phrase there, let's do this, Cayman. What did you mean by that? What are you asking Cayman to do? Could you speak a little to that, please?
I want the country to understand that we are in this together. The government is here to provide support, to provide education, to essentially confirm that we are able to get through this together. We have to transition from what has existed in the past 18 months of the strategy of elimination to a strategy of managing and living with COVID. Now, it doesn't matter whose plan that existed, whose plan was being followed. If there's a plan to reopen the country, reopen to the outside world and have greater freedom of travel, this was going to be the result. We've said this many times, there's going to be COVID in the community. And this, as I said before, this happened a little sooner than expected, but we're confident that given the level, the high level of vaccination that we have, and we're still trying to drive that even higher because we understand the significance and the role of the vaccine in our people being safe, that once we combine our collective efforts of relying on the vaccine, looking after each other, as Minister Turner has shared, doing all the things that we need to do to protect each other, to protect ourselves, Cayman can get through this. We can successfully continue to live and exist and do business while maintaining our levels of safety. We have not locked anything down. We don't anticipate having to be in that situation at all. We are going to get through this safely, and Cayman can have confidence in that.
Thank you very much, sir. Kind of a follow-up to that, and I admit I might have what Minister Turner calls quarantine fatigue. I'm trying to get a sense. We had these different phases set up for the reopening. We've paused, but I am having trouble summarizing for people. We've paused, but where are we? I know that you're still drafting some of the guidelines and rules, but right. Where are we right now?
So we have paused on phase 3. Phase 3, you will remember, came into effect on September 9th. At that point, that involved primarily the significant change there would have been that people could come into travelers could come into the Cayman Islands without having to have any kind of connection, without having to be related to or connected to somebody who resides here, without having to own property or anything like that. They can come in effectively as tourists. So we're not going back to phase 2. I've seen some discussions and some summaries of where we're at. indicating that we were sort of going back to phase 2. That is not the case at this point. We are paused on phase 3. Now, the reality, though, is that because we haven't moved forward with the plan on October 14th to eliminate quarantines, we don't have things like additional flights coming in. We don't have other airlines coming in. But effectively, we're still paused on phase 3. We've lost your audio.
Apologies, I'm not as fast on the trigger as I should be. In terms of Cayman Airways, are we still doing repatriation flights as we have been, or is this the equivalent of what British Airways is doing, where it is resuming a schedule?
I don't know that they are resuming a normal schedule, but yes, it's not effectively phase 3 and September 9th meant that we transition into an open skies agreement scenario where other airlines could come in if they felt that the demand warranted it. As I said before, and as the Minister for Tourism has indicated previously, the airlines were indicating that some were going to start operating towards the end of October and going into November. Sorry, the foreign airlines were indicating towards the end of October and into November. I'm assuming that means, and forgive me for not knowing specifically, but I'm assuming that because we're in the open skies arena now, that must mean that these are no longer regarded as repatriation flights, and Cayman Airways has the flexibility to adjust to meet demand, subject to people's, whether they're foreigners or whether they're people from the islands wishing to travel.
All right, thank you very much, sir. I have some other questions. I don't think these are yours, but feel free to jump in if they are. His Excellency mentioned booster shots, and I believe it was mentioned elsewhere as well. But there does seem to be a great deal of debate that we're seeing about booster shots, whether they should be available to the general public or not. There are the ethical questions of there are countries who still haven't had any or enough vaccines. What's our position here in Cayman about boosters? I know that they're coming in, but where are we in terms of how we see the booster program?
So in Cayman, we are following the UK rollout program on vaccines. So the UK has taken the decision that it does believe, to protect the population there, that it should roll out boosters, and it started already, actually, yesterday, rolling out to over 50s. So we're following the same, but we have some flexibility because our situation is different, and if we decide we need to go further, we can do that, and we can bring in extra vaccines. I mean, I absolutely think we all understand the ethical aspects of this, but I think every government's primary responsibility is to protect its own people. But I know the UK is doing a huge amount to try and make sure that millions of vaccines from the UK are supplied to countries around the world as well.
The next sort of question to that is related to something I think you spoke about the other day, Your Excellency, and this is partly my ignorance as well. In terms of other vaccines, we know the UK wouldn't be sending Sinopharm, I think is what it was called, to Cayman. I've had people asking, but if we don't want it from the UK, but we just want to have this vaccine as an option for us, is that possible? How does that work? So I thought it might be appropriate to explain to folks, perhaps this is Dr. Lee, how that process would work.
I think if Dr. Lee wants to answer that, I'm sure he's far better at doing so than I am.
Good afternoon, April. I think as far as vaccines that haven't been approved by the major stringent regulatory authorities, I would not be keen to approve them here. What we want to do with a vaccination program in a pandemic, I'm not talking about a routine vaccination program, but in the middle of the pandemic, is to make sure that we protect the entire population. And for that reason, we have restricted the vaccinations available in line with many other countries, multiple countries of the world, to the 4 that we currently have.
Thank you, sir. That helps there. One of the other sort of questions, not really directly related, but in the same vein of information, really had to do with people asking me questions about databases and how the information is collected and processed in terms of not just vaccines or permissions for things, but also just the data itself, you know, side effects, those sorts of things. And it sounded the other day from one of the videos that you released that some of this process does sound a bit manual. Are there any plans to beef up the way we're collecting data and inputting data and making it more accessible and easier for health officials like yourself to be able to make decisions?
There are always plans, April. Unfortunately, they haven't come to fruition yet. We're well aware that in order to make good healthcare decisions for any modern country, those decisions need to be based on data and strong systems behind supporting that data. I am very pleased that with the national unique identifier that we're all going to have, that this might also have health applications, and we are looking to plan towards improving quite considerably the medical epidemiology, because this will enable us to make better decisions not only about a pandemic or infectious diseases, but also about non-communicable diseases as well.
And generally speaking, in terms of health, we have put a lot of emphasis on the vaccination component of things. But there are folks who are also saying for those who cannot get vaccinated, or even those who are, since they can still potentially get COVID as well, are there other things that they should be doing in terms of, you know, just general good health, good eating, et cetera?
Yeah, I think the minister's already brought up many of the non-pharmaceutical interventions. Those are exceedingly important. But paying attention, I mean, for COVID, just like any other disease, paying attention to all of the things we know will help your health, keeping as fit as you can, making sure you're exercising your heart on a daily basis, eating as well as you can. I know that's sometimes difficult, but doing all of these things are incredibly important to your good health. But I think of all of those things, it is being active is by far the biggest there.
We've talked a lot about we're following the science and the data around a lot of things. And I did get a little lost when it came to the quarantine periods at various points. So we went from this period to this to the other, whether you're vaccinated or not vaccinated. And so I'm trying to get a sense of today what the science says about quarantining and isolation periods, because we did have those 5 days, and then I heard for vaccinated people 10 days, and then 14 days. So I not so much about policy from my perspective, but kind of where are we in the world in terms of that decisions, those kinds of decisions?
The decisions around, I think you're really talking about border control decisions and about biosecurity across the border. There is no change, just to preface that, there is no change around the incubation period for the virus, which is 14 days. Somebody could catch it, develop symptoms after 2 days, or it could be up to 14 days. If you're vaccinated, it's likely that will be a little bit less, but we don't have any confirmed evidence in that regard, but it is very likely. But I think what you're asking is about border controls. And there is no doubt that if you keep the border controls at 14 days, or in some countries at 21 days quarantine, you are in a safer place than if you have them at a shorter period. But as we move towards the reopening, we have gradually changed that for the people who are fully vaccinated in order to make it more relaxed for them. Clearly, the cabinet and everybody in the country has been very worried by this outbreak, and so we've sought to, during our pause, to strengthen that situation for a period of time whilst we're able to assess that, and that's exactly what I understand is being done. Minister of Health may be able to answer better. I'm not sure if that addresses your question, April.
So I'm embarrassed to say that my question wasn't as sophisticated as you thought. It was literally, is it still take 14 days for us to see if we have COVID or not?
Yes,
it was actually that simple.
Yes, it is. Yes.
Okay, great. That helps a great deal. Before I get kicked out for the next reporter, I just want to make sure I didn't miss any of the questions We still don't know the origin of the current outbreak, so it does make it very difficult to make decisions accordingly. But I found my other question. It had to do with school closures. Is the trigger point for closing a school one case? You touched on this earlier, I think, Dr. Lee. Or is it, do you have to weigh whether there are multiple classes involved? I was just trying to understand what would trigger us to close the school and then what determines how long we might close the school for.
I think it will really depend on what stage of the process we are in as we go forward. Clearly, we were not expecting this to happen. It happened earlier than we thought it would do. So our concern levels were naturally heightened right across the board, you know, not only the public's, which is obviously understandable, but certainly everybody in health was a little surprised too. And to find quite so many, and also not to be able to trace it back to a traveler. But as we've been saying, and as I've been saying, as everybody has really been saying, we were waiting for it to happen. It's just, I guess it was a surprise when it came, having had a whole year of such, well, relatively comfortable living. So we're certainly, we are drawing up more detailed plans for what that would look like should it happen again, and there's a draft that's already being circulated. I don't have it to share with you today, but that plan is being drawn up.
Thank you very much. That's all my questions for today.
Okay, thank you very much, April. We're going to go now to Wendy from CNS, also joining us via Zoom. Wendy, are you there?
Yes, I'm there, Donna. Sorry, it just takes a second or two with all these windows open on the computer. Can you hear me okay?
Yes, please go ahead.
Great, I shall start with my questions. The first question I have is just a quick one for Dr. Lee, which is what's the situation on the us sourcing lateral flow tests and home testing kits? A lot of people are asking about that.
Yes, I think they're going to be an incredibly useful tool, really, really useful. And I'm hoping that they will be so prevalent that, you know, we can just reach for them and do a test should we be worried. We need a bit more information and guidance to be fleshed out around that. The program board is already working on that. We have been in discussion with Crown agents because clearly if we are able to buy a lot of these, and I'm not talking about 5,000 or 10,000, I'm talking about hundreds of thousands of tests. If we're able to buy a lot of these, then not only can we get the economies of scale with a big order, we can also have the confidence that we're choosing tests that we know are to be sensitive and reliable. So at the moment, we're looking at tests that are probably going to come in the order of $2 each. And be able to use them quite widely across certainly the government sector. We need to discuss further about how these are deployed elsewhere as well. So they'll be very important, I believe. You can imagine perhaps you're going to school, you need to do a lateral flow test on a Monday morning or a Sunday night before you go, and then you can go to school if you're clear. That sort of thing in order to improve safety. And we're also very much looking at tests which will be user-friendly. So I'm imagining, you know, anybody, well, depending on competencies, people over the age of 5 or 6 may be able to do the test on their own, perhaps even have some fun doing it. And there are a lot of videos out there to explain how kids and families can do them together. Hope that answers the question.
Okay, that's great. No, actually, I was aware of that. You said that before. I was just wondering when. What kind of timeline are we talking about? Because you implied it would be a lot sooner.
We do have some on the island already. We have about 3,000 at the HSA already, but those are not actually as they're not designed for home use. They're more for a professional to help guide them. An order. I've signed a piece of paper. I don't have purchasing rights, but I've signed a piece of paper saying, please, can these be purchased? So hopefully quite soon, Wendy. I don't have a delivery date. I don't know what the lead time is. I'm sorry, I haven't got that information. But
okay, so it could still be weeks.
Yes, I would imagine weeks, not days.
Okay, great. The next question I have for you, Dr. Lee, is regarding the prison. I know you didn't have any additional positives amongst community people today. So can I just clear, have all the prisoners been tested and they're all good to go, or are you still working through the prison?
There wouldn't really be any reason to test the prisoners today because we have to work out the timing of the possible exposure and when to test them. And I will be discussing that with Steve Barrett, the prison director, and at some point either he or I will share that information with the public, but I wish to have that discussion with him. But we do have plans that we've already discussed today that we wish to discuss further with the prison director about how to move that issue forward, to make sure everybody is comfortable and happy that they're safe and that their systems are being supported by public health.
Okay, cool. Also, we've had some issues. It seems people are confused about the instructions and the requirement for isolation. So if you are a primary contact, or you've been told that you're a primary contact, even if you're negative, is everybody isolating for 15 days?
As I mentioned earlier, because so much of the school seems to have been affected, we've asked that everybody related to the Georgetown Primary School outbreak should remain in isolation for 14 days. Not all of those people will be tested. It's only the people who have COVID that will be tested and their families on exit.
Okay, cool. That makes sense. I just wanted you to be clear about that. Okay, fine. I think all the rest of my questions would be for the Premier or other members of the panel.
In there, if I may. But clearly, if anybody who is in isolation related to the Georgetown Primary School should get any symptoms or feel unwell, please can they contact their healthcare provider or the flu hotline, because obviously we would want to check on those people.
Okay, great. And my next question then is for the Premier. Mr. Premier, are the regulations already in place for the coming travellers now who are fully verifiably vaccinated, quarantining for 7 days instead of 5, and are they now wearing tags, or is it still to come?
Well, I think you're sort of mixing up a few different scenarios there, but in relation to the, and it's useful for me to re-emphasize, in relation to the regulations dealing with quarantines, with masking, social gatherings, these types of things. What I indicated earlier was that these were being finalized, and we would be adopting those come early next week to move forward with those. So, the issues around the 7-day quarantine and whatnot, that's all going to be clarified at that point. We'll have a separate press conference in order to make the details around that very clear. You mentioned geotagging. That is, as far as I know, that is being carried out again now, but that's obviously going to be a part of it.
Okay. The next thing is, can I just see where you are with the? There's a lot of talk in the community about it is that government isn't mandating vaccines for particularly teachers and healthcare workers. Have you reconsidered that yet? Or are you still, no, we don't want to mandate?
That is, to be honest, something that we haven't specifically addressed in terms of a discussion. But yes, that is under consideration generally.
Okay. The next one is the leader of the opposition. You said no to him. Have you got a specific reason why?
I said no to him in relation to what?
He offered to help.
Well, I haven't.
He sent you a letter.
Yeah, he has sent a letter. But let me be clear that I will. That letter was received a few days ago. I will send a response to him. So we will be engaging. But at this point, I think I made it clear in the last press briefing that, in our view, for two reasons. One, in our view, we don't need to engage with them. Firstly, because we are relying on the same advisors that advised the previous government. So I don't see anything changing there. It's not. I'm not aware of any instances where they brought any new perspective or any incredibly successful strategy to the table which wasn't considered and advised by the program board. And the other thing is, I think we can see from the comments that have been made that their experience has been around lockdown, around elimination and elimination strategy. And they successfully did that. So they should, I've said before many times that they should get credit for that. The former premier, we gave him credit for that, and absolutely that was a success. This where we're at now, where any government would be in terms of a reopening strategy, is necessarily going to involve a different approach. Nothing to do with necessarily elimination. This is about learning how to safely live with this, how to manage the risks, how to keep people safe, how to keep our children as safe as possible, and how to build confidence around that. So I don't really see them having that type of skill or experience that is going to be useful. And from a political perspective, just as they wouldn't have, engaged, they had the opportunity over when they were in government to create a national COVID council. They had more reason to do it at that time. They didn't do it then. So I don't think that this is something that we should be considering from a political perspective. We're absolutely fine in relying on the advice that we have from public health, Dr. Lee, all the other great doctors at the HSA, and the fantastic people ably led by the Deputy Governor on the program board. So those are the people that we're looking to for advice and telling us how to move forward, because this is a new regime. This is a new way of addressing this problem. It makes no sense for us to rely on people who have experience with the past.
Thank you. I just have one final question, which is really for the Health Minister. There was a letter which was circulating on social media today, which is basically reflecting the experiences of a parent who took their child to the flu clinic on Tuesday, and it all seemed to be a bit chaotic. We can understand that these issues are obviously going to come up, but one of the things that you said is the Public Health England advice was that we had to be sure our health systems were robust. Can the Health Minister give us some reassurances that that type of experience, that parent experience won't be happening again, and that the Health Services Authority has got its act together about the flu clinic?
Thank you for that question, and I am aware of the email, and I have been reliably informed that Public Health and HSA representatives have actually communicated with that parent. I want to take this opportunity to apologize for any inconvenience that may have been experienced, but understanding the nature of what we were dealing with, the panic, the hysteria, and everything that descended on that facility, and understanding the raw emotions that are being expressed. But I can assure you that the able staff of public health and whatever policies and practices that they have to make sure that people who are accessing their services will always be held at the highest standard. And this is something that we can move forward in this very delicate and challenging time so that, yes, it will not be repeated.
Thank you. I'm done. Thank you, Donna.
Okay, thank you, Wendy. We now go to Andrel Harris from Compass Media, who's in studio with us. Andrel?
Thank you, Donna. My first question is to Dr. Lee. This one's yours as well, Dr. Lee. Oh, where is it? So, Dr. Lee, can I get a quick update on the total vaccination rates as well as the known percentage of the Delta strain within the community?
I don't have either of those figures, I'm sorry. I've been so focused on this outbreak. I don't have the vaccination figures for today. I know the figure is still sitting at 76% for first dose. That figure hasn't shifted, but I don't have the absolute number, and is sitting at 71% for the second doses. As far as the Delta strain, I've not been asked that question before. The information, and I couldn't actually give it to you now, if I could explain why. When we look at the quantity of virus, we can only do genomic sequencing if the quantity of virus is significant, if there's a significant concentration. So we look at this figure called the CT value that you've heard about. If that CT value is above 30, it means there's not too much virus there. And if it's above 30, we can't do the genomic sequencing because we'll run it, it'll take an hour, it'll take a day or a day and a half, and it'll come back and say no results. So it doesn't, we couldn't ever tell you how many of the Delta variant are honestly here because we can only do genomic sequencing on the strongest samples that we get. So we could give you a reflective value. I would imagine that of the tests that we do run, the genomic sequencing, it's currently about 70% that are coming back with Delta.
Final question for you, Dr. Lee. Can we get an update, perhaps this might be someone else, the commissioner isn't here, but then, so I guess it falls to you. Can we get an update on the passenger that arrived on Cayman Airways from Jamaica, as well as the passengers that went to Cayman Brac? What's the status on the investigation, on those investigations?
Yes,
what's the findings?
That's not something I'm able to help you with, I'm sorry.
Well, then perhaps,
The police is not here.
perhaps the Minister of Health might be able to help us here.
That would be a matter to be where investigation is concerned, and those respective persons are not here. But Dr. Lee, if you don't mind, the stats shared with me in response to your first question of the vaccines.
Yeah.
As of 8 a.m. this morning, there were a total, and I'll just give you everything, including PCR test that has been reliably shared to me as Minister, 1,394 PCR tests since last reported, and there has been 104,000 COVID vaccinations given in total in the Cayman Islands. 53,000 or 76% of 7 to 1,106 have had at least one dose of COVID-19 vaccine, and 50,000, approximately 7 to 1%, have completed the 2-dose course. So I hope that answers your first question. But in regards to your latter, the respective persons who can honestly answer that is not here, but I'll do my best to get you that information.
Thank you. Premier Panton.
Yes, sir.
In essence, Dr. Lee's pretty much said that there are hundreds of households from Georgetown Primary that are now going to be quarantining for upwards of, 14 days, and that being tested, some of them being tested on 15 days. What is your government going to do to support the families who have found themselves in quarantine, who perhaps weren't prepared and don't have any supplies to ride out 14 days?
So those are all, that's a good question, and those are things that have been considered by both the Education Ministry as well as public health and also Mr. Ebank's ministry dealing with social development. Those all of those relevant ministries are looking at this issue, and we are going to be addressing those needs and making sure that the people have the supplies that they need and have the types of services that they need to effectively assist them to get through this difficult process. We understand that there are concerns there. There are very legitimate concerns, and we will be making sure that we address those.
Premier Panton, you said, and the Health Minister said, and Dr. Lee Rodriguez, when he was here, Dr. Rodriguez, my apologies, said last week that the Cayman Islands, the Health Services Authority, had all the requisite protective gear, PPE. They had the knowledge and the know-how of how to tackle COVID-19. And it was further said that the country was in a right place. They were prepared to go ahead. What more does the government need to prepare for the borders to reopen? What more do we need if we have all the gear and the equipment and the experience and expertise? What more lessons is the government waiting for to go ahead with phase 4?
Well, Andrel, I know you are an individual that monitors social media as well. So you will have seen the reactions from the parents in particular around this issue of a cluster of positives being identified in one particular school. So when this happens, it's unexpected. There is no opportunity to address and try to help build confidence around the ability to handle this safely. And frankly, parents, I think when something like this happens, you switch from being concerned, you're not rationalizing anymore, you're driven by emotion. And that was effectively one of the driving issues for us. We needed time to make sure that we could be able to understand what the extent of the problem was and build confidence amongst the people of the country. That's why we said, look, we're going to pause this at this point. There was a very significant reaction from the public saying, everything from lockdown to, what are you going to do? How can you tell me if my child is positive right now? So we needed time for the society to adjust. We needed time to ensure that we understood what was involved with this current outbreak. It as I said, we still don't know how it happened. We have no evidence that suggests that it happened because of a traveler. So we're looking around at all sorts of possible implications and sources for this. But the major point was trying to get people settled. We have been in this cocoon, we've been in this bubble very successfully for 18 months, a little over 18 months, and coming out of that in a scenario where it's unexpected creates a shock, creates a level of concern that we needed time to manage, and society needed time to adjust. So we didn't feel it was at all appropriate to just say to the people of this country, yes, we're notwithstanding this level of concern and the angst and the fear that existed about what they didn't know, we were just going to go ahead. That would be absolutely cruel to take that sort of approach. So this gives us an opportunity to reflect. It also gives us an opportunity to understand where we can do things better, and society can get to a point where they have greater confidence that we can get through this, and this is something that we can continue to live with and manage.
I believe Minister Turner has a response for you as well.
Yes, Mr. Harris, I have a response in regards to the travelers to the BRAC, and just to make it, I've been clear, because it is rumored that these passengers are positive, and there's a rumor going around, but I've been reliably informed as to how that went. The individuals traveled to Cayman BRAC without any knowledge that of the COVID positive case at Georgetown Primary School. Upon arriving in Cayman BRAC and being aware of what had happened, they presented themselves at Faith Hospital. They were all swabbed, and they are now in isolation. In knowing of how the events took place, they're not, in this case, considered breaching of anything. In regards to the Jamaican traveler, the passenger from Jamaica, that is a matter in the hands of the Royal Cayman Islands Police, and that, in regards to that particular case, I'll have to get additional information for you on that one.
Two final questions, please. I know. Won't be invited back. What are the penalties, Premier? You outlined some of the new regulations, but what are some of the penalties that come along with the new regulations? You didn't say.
Same thing.
I think the penalties are the same as have existed for previous regulations in relation to these types of controls. I think it's a fine up to $10,000 and a possible prison or custodial sentence up to 2 years.
And finally, should you win over public faith and trust and confidence between now and the 14th of October, will your government look to lift this pause and perhaps move ahead with the reopening?
That is something that we can continually keep under review. I didn't say that we were going to do it at a particular time, a particular date. So yes, this is something that can be considered, but we have got to ensure that that we understand where we've addressed, that we've learned the lessons that we have, and address any concerns around capacity issues right now, and importantly, that the people of the country, and we feel that people of the country understand what's involved, and they're confident enough that we can move forward. We do not want to have a scenario where, as I said before, we had last week with the kind of concern we had last week and just move forward. So it will depend on the circumstances. It'll depend on how comfortable we are with the state of readiness for the country to move forward. I just want to address, because I've had a message from someone in relation to the rules around the BRAC, which I mentioned earlier, and the controls. Let me say the sister islands, not just the BRAC. If we have the rule in relation to vaccinations, yes, that is intended to help drive vaccinations. That is a recognition of the fact that vaccinations will help to keep people safe, will have a lower incidence of infection, a lower incidence of transmission. The truth is there isn't anything, and we have the rule in relation to, in the alternative, not having a confirmed vaccination, then you have to provide a PCR test. The truth is that nothing we provide is going to be a concrete protection for or barrier to COVID getting in to the sister islands from a traveler. You can test positive a day after or 2 days after you test negative on a PCR. I mean, maybe Dr. Lee can advise if he thinks that's different, but as far as I'm aware, that's the position. It's a snapshot in time. So while we try our best to try to minimize the risk, we cannot entirely eliminate the risk. And for anyone who suggests that there are strategies out there to entirely eliminate the risk, no. In terms of testing, that's not going to be the case. If we put in place quarantine provisions where you have to stay for 28 days or something like that in quarantine, if you go to the BRAC, maybe that would be closer to something more ironclad. But short of that, testing is not going to be an ironclad guarantee. We're talking about reducing risk.
And while I have more questions, I'll wait for the next one.
All right, thanks, Andrea. We'll call on Ralph from Cayman Times next, and then we're going to wrap up.
Good afternoon. Thank you. Good afternoon, members of the panel. It's been a long week, and it's Friday, so I will be very brief. I have two short questions, and the first for Dr. Lee, and the final one is for you, Mr. Premier.
Yes, sir.
Dr. Lee, I asked this question last year, and maybe you can give me an update to it. How accurate are those tests, PCR and actual COVID tests? Are they 100% accurate?
Nothing is 100% accurate, and one of the big problems is the sampling. So that can often fail. So we often get tests that come back, and there is some fault with them. They don't actually bother to explain what the fault was, but we then need to resample the patient or rerun the test as a result. When we run a test, we also check. There are lots of internal and external controls. One of the things they do, which is easy for me to understand, is that they check for human DNA. So if they know a piece of human is in there, then they know that the swab has probably done its job. Right. And so they can also look for the virus too.
So just to clarify, if I traveled overseas and came back, did my 5-day for now quarantine, and did my test and it came back negative, it could be positive.
It is possible that it's positive because you may actually be still incubating the virus, so you could actually have a long incubation. If you're fully vaccinated, we think it's much less likely that that scenario will be the case. For the lateral flow test, they are probably somewhere between 50 and 80% as accurate as PCR tests. They become more accurate when you use them sequentially, when you keep using them, and they also become more accurate if the sample is taken by an experienced person. So we want to get you all trained up to do it yourselves.
Yes. So just to finish that point, then many other ways that we could have positive cases in the community and we don't know about it.
Yes, it's possible. Because we've been shortening the quarantine period with a view to reopening, I mean, that's the only way to go if you're going to reopen.
Yes.
That is possible that it came in that way, but then you might expect that we'd be able to link it to a traveller, and we haven't yet been able to do so.
Okay, thank you very much, Doctor.
Thank you.
and I'll move to the chair. It's been a tough week for you, Mr. Premier, and Andrel started my question. I'll just finish it. It's regarding some clarity on the pause. I mean, use different words. I may say, I prefer not to use pause. Pause could be when you stop and you go back to the previous phase. But I would say probably hold.
You press pause. On a video, it stops, right? It doesn't go backwards. It stops where you are.
Yes, but we're still allowing passengers to come in and still 5 days in quarantine at this point. So we're still doing it. But that's semantics, as we call it. In the reporting on Tuesday, you mentioned that we may be pausing until the end of the year. In your presentation this evening, I'm sort of hearing that maybe after you do have some other discussions that you may be revisiting that timeline. Is that the case?
As I said, I don't know that I can really add more to what I said in relation to Andrel's question. This is something that we are looking to pause for a period of time, as much as to the end of the year, but we have to have the flexibility, and I think if we don't have a specific date that we say we're going to end the pause or to reopen at this point, it gives us some degree of flexibility. Is it going to be October 14th? Absolutely not.
Right.
So people can be assured of that. Beyond that, it's difficult to say. But
and
it depends on where we're at as a country and how confident we can be.
And in terms of indefinite period, it's definitely not true. There should be some time.
No, there is no indefinite. No, I mean, I think we have, everybody in this country has accepted that we've got to be able to reopen at some point. So it cannot be an indefinite pause. This is about making sure that when we do decide to move forward, we have the country in the best possible place. Our people who are ready for this, understand exactly what all the implications are, and we in government are confident that we can do it safely.
Okay. And one final question: if next week Tuesday we hear that there's another case at another school, how should we feel? How should we react?
Sorry, can you say that again?
If next week Tuesday we hear that reports of another positive case in schools again, similar to what happened last week, how should we feel? Should we be alarmed, or should we be more calm and deal with the matter as we're doing now?
Well, no, I think we should be more calm about it because we have a better idea of what to expect. Experience is one of the greatest teachers in life, obviously, and we have not had children who have gotten sick. We do have some who are symptomatic. We have some who are asymptomatic, half probably, who are asymptomatic. And obviously we are concerned about ensuring that our children are as safe as possible. But as has been discussed previously, statistically, they are more resilient. And I certainly I'm not going to get into statistics and all this sort of stuff that's typically used. I mean, we're concerned about every child, about every parent that has concerns. But we can respond to these types of things in a more calm fashion based on our the prior experience. I think the only concern would be whether we have significantly greater types of community spread that will generate much more of an emotional response. I think having one or two is not unexpected.
Okay, thank you, and I'll leave it there for tonight. Donna, wish you all luck.
Okay, thank you very much. Ralph, any final words from our panelists? No. Okay, all right, thank you.
I just want to say that I want to wish all of those who have been identified as positive, particularly those who are symptomatic. I want to wish them the best, and hopefully they'll come through fine, and they will be well. And I want the people of the country to go into this weekend knowing that all the various facets of government are working hard to ensure that, people are as safe as possible. And I think what we have learned from this, it can give us a growing sense of confidence, a sense of calm. Obviously, as I said before, when it comes to our children, we're all very much, concerned. But I want everyone to have a good weekend. I want everyone to be calm and understand that we can get through this together. We can express confidence, we can support each other, we can do all the things that we know we need to do in order to protect each other and to protect ourselves. This is not something that's unknown. This is nothing new now. So let's do this, Cayman. Thank you all very much.
Thank you very much, Premier Panton. And as always, thank you to members of the public as well as to the media for joining us, and for our panelists for sharing this important information. Remember, you can go on the CIG Television YouTube channel and watch the press conference on demand. Also visit gov.ky and hsa.ky for the very latest on COVID-19 results as well as vaccination clinic schedules. Until next time, have a safe and wonderful weekend, everyone.